I'm going to provide privacy. Check the patient's name and date of birth. Check the patient's allergies and medication allergies, also their blood type. And then I'm going to wash my hands. And I'm going to wear my gloves. So if the patient does not have any blood, we don't know their blood type yet, we're going to get blood from them, from a phlebotomist, and then we're going to witness it. And then they're going to bring it to the lab so we can get it for cross-match and typing. So if we do know their blood type, we can tell the patient that we have doctor's orders for blood transfusion, either due to low platelets, low blood count, anemia, anything like that. So before we do that, I'm going to check the patient's line to see if it's patent. I'm going to clean it with an alcohol swab. Clean this with an alcohol swab. Okay. I'm going to get my saline lock, open it. Make sure it's not kinked or anything. Open it up. Connect it to the saline lock. Okay. Push in at least 5 cc's of saline. Perfect. I'm going to close off this. Perfect. That here. Okay, so now I'm gonna do the saline. So first I'm gonna open up the saline and check the saline to see the expiration date. Then I'm gonna write my initials on the saline bag. And then I'm gonna spike the saline bag. Okay. Then I'm going to prime the saline line. So this we'll pretend that this has no blood, and I'm just priming it to make sure. Then I'm going to clamp it up once it's primed.
Is it right enough?
Yeah, they should have
Oh, the other way, man.
Oh my gosh.
There you go.
Oh shit, it's falling on the floor too. It's not supposed to fall on the floor. Okay, so after I make sure it's the right patient, blood, I'm gonna go to the lab and get their blood. So I'm gonna take my MMR with me. So I'm gonna go to the person. I'm looking for Dylan Sabatino's blood. Okay, here it is. Okay,
We'll go ahead and
thank you. Okay, so you're gonna read it off to me, or I'm gonna read it off to you to verify. So it's Dylan Danilo Ocampo. It's red blood cells, and then it's negative O blood cells. Expires 12/16/17. Patient's date of birth is 12/25/1946. MR number 02017731. Blood type O, age 71, and no known allergies.
All right, okay. Sign here. Take my copy.
Okay, I'm gonna sign it and then sign the same copy, and then you take it away.
Yeah.
And then now I have the blood and the blood paper. I'm gonna go to the patient. Okay. First, I'm gonna make sure it's the right patient, right date of birth, no allergies, right blood, and then now I'm gonna start your. Now I'm gonna talk to the nurse that's also here to confirm that we have the right blood. So you're the nurse again, and then I'm gonna read it off to you again. Blah 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 blah. Okay. Sign as my witness.
All right. I signed as your witness.
Good. And I'm gonna sign it. So one goes into the medication record in the little folder, and one goes at the nurse's station. There's a place for there.
The medical chart.
The medical chart. Yeah. And then now I'm gonna start your blood transfusion. So I'm gonna put the blood here, spike it, and then I'm gonna prime it as well. So I'll do this manually. So get it out of the machine, manually prime it. Okay. And now I'm going to start the blood transfusion. So first, I'm going to connect this. Oh! You guys incorrect me. First, I'm going to start back. Do the TKO to keep the vein open.
Yes.
And y'all corrected me.
Yes, I'm so sorry, Bruce.
There you go. Hold on. So first, you got to do the TKO before you leave the room to go to get the blood.
You already did a TKO.
No, you didn't.
I did
you just put the 5 cc's in.
Yeah,
to make sure.
Yeah. It's alright. So, no. Yes. Channel select. Basic infusion rate 20. And then volume is 50. So you let this run to keep the vein open. So that's TKO. So after you get your blood, now we get our blood. Pause it. We clamp up our saline. And then we open up our blood. Now we're gonna start it. Channel select. Our rate is gonna be 60 for the first 15 minutes. And then the volume is 300 mLs.
No, yeah, you're right. I'm sorry. I was thinking saline.
It's all good. So I'm gonna let that run. Okay, once that's running, I look for the patient for the first 15 minutes to notice if there's any adverse reactions. So it's gonna be cool, clammy skin, hypotension, urticaria or hives, any redness or rashes, any itchiness, and then any tachycardia as well. So if they do have an adverse reaction, I stop the blood transfusion, notify the doctor, and also check their vital signs right now and every 15 minutes. If they don't have any adverse reactions, you check their vital signs every hour to see how they're doing. Okay. So now, after 15 minutes, if everything is okay, I'm gonna change the infusion rate. Change the infusion rate to 75 because you do 4 hours, so 300 divided by 4 is 75. And then you start that. You can only use every bag for every 4 hours, and then you can only use this line for 2 units of blood. So you have to change it out after that or per facility protocol. So after I do blood transfusion, just notice if anything's going wrong, put the bed in lowest position, call out within reach, and then come back after 4 hours if the blood's done, and then
So they are done. I asked them to be done so you could do your G2.